Their waiting rooms can be very chaotic environments, which increase that individual's stress level and fight, flight, freeze response before the appointment even begins. This is a photo of we had the opportunity in that same dental clinic to kind of repurpose a storage room as a sensory waiting room. And we actually heard from them recently that they had a patient who was having a really difficult time in the operatory. And so they took that patient into this waiting room. And after a couple minutes, they were able to actually just apply the fluoride varnish in this room without needing to go back to the operatory. And so if you have the ability to dedicate a space and make it sensory inclusive on the waiting room side of things, that really supports this population. And additionally, I did get this feedback a lot too. The staff were starting to argue over who was going to get to use the room during their lunch break, because it does also provide that additional level of kind of, having that meditative space that you can use throughout the day. Where if you don't have the ability to kind of make adjustments in your waiting area, there's a couple options. One, is there an unused space in the actual clinical area? Like in this example, there was a file room that they weren't using anymore. But outside of that, can you let the patient wait in the car until their appointment's ready? Is there a separate entrance? I recently visited a clinic where they had kind of a back door that was right next to a quiet operatory. And so that was, a way that they could get patients in without having to go through the main room. But just, being flexible with how the patient flow works, right? Because the waiting room is a big issue. I was talking to somebody who had done a bunch of work at a hospital to really upgrade their ER from a sensory standpoint. But you got there, and to get to the adapted ER rooms, you still had to walk through the main emergency room lobby. And that's emergency room lobby is a sensory nightmare. And so, having that whole holistic approach of, okay, how is the patient going to get from their vehicle to the exam room in the least intrusive way possible, right? What are the areas that we can adapt? And if we're limited on what we can do, providing, those over-ear headphones, sunglasses, whatever it may be, maybe to them while they're in the car to kind of better prepare, or have the parent, patient, caregiver, whoever it is who's bringing them, kind of have those things in mind before arriving so that they can kind of preemptively be ready for it.